Brain arteriovenous malformations are abnormalities of arteries which supply blood to the brain and veins which take out blood from the brain. There is an abnormal connection between them and there is very high flow in these malformations which can result in swelling of brain blood vessels and bleeding, sometimes seizures, or sometimes some kind of neurological deficit. One of the ways to treat brain AVM is that we take a very thin tube through the left blood vessel into the brain and inject material known as ONYX. This procedure is known as embolization. A patient with brain AVM, arteriovenous malformation, we take a very thin microcatheter into the brain blood vessel, into the AVM, and inject dye to see the AVM as well as normal blood vessels. We can inject dye many times to be very sure that we are only filling the AVM and not the normal blood vessels. By this checking, we can be sure that we are not going to cause damage to the normal brain. After doing these checks and when we are very sure that we are in the right place to inject, we flush the catheter and then fill it with ONYX, which is black colored liquid in this syringe. We inject this ONYX very slowly and under image guidance. As you can see in the center, the white screen, the black colored ONYX is coming out. ONYX is like lava. Some part solidifies, but a part of it remains liquid and keeps flowing into the AVM blood vessels. And since the procedure is done under image guidance, we are very sure it is only going into the abnormal AVM blood vessels and not the normal blood vessels. It can go into the very small branches as well so that we can completely close the AVM. After a while, it starts to come back on the microcatheter, what we call as reflux on the microcatheter. Once the reflux has happened, we can stop and wait for a minute or two for that part to solidify. Once we are sure that part has solidified, once we start to inject again, it doesn't come back but goes forward into rest of the AVM blood vessels. Again a slow injection to fill rest of the AVM. ONYX keep going forward till we are very sure we have completely closed the AVM, and which is checked by the angiograms that the AVM is not filling any longer. Then from outside we can check that the AVM is completely gone, the black colored AVM is gone, and we slowly pull the microcatheter to take it out of the ONYX cast. So microcatheter is taken out, and without doing any open surgery, we have been able to cure the brain arteriovenous malformation.